GPGC?
GPGC is a member-based organisation made up of general practitioners. Our main role is kind of threefold. So we do a lot of advocacy work. So we're trying to improve things for our general practice on the ground. We do some educational activities and we provide networking. But I think a lot of us GPs, we're so isolated. We're stuck in our little rooms all day. Just having that peer-to-peer support would be a very good first step, whether it's to talk about a difficult patient you've had or just to say, hey, life's a bit tough right now. It's about having a voice and actually changing the things that we can change. And there's a lot that we can change and there's a lot that we can make better. But it has to start with small steps and it has to start with people being engaged. So in my ideal world, it would be a seamless healthcare system whereby you'd have your general practitioners working closely with all the other specialists and all the other allied health without any disrespect, without any of this political argy-bargy, and there would be respect across all doctors and there wouldn't be this hierarchy.
Hello to our amazing viewers from all around the world and welcome to another exciting episode of MedCentres TV podcast, where we dive into the latest in healthcare, wellness, and medical breakthroughs. I'm your host, Dion Raju, and today we have a truly inspiring guest joining us. Dr. Nicole Langsford is with us today. Before moving on, I would like to introduce our esteemed guest to our viewers. Dr. Nicole serves as a board director of Wentworth Healthcare and previously held the same position at GP Training Queensland. She is a graduate of the Australian Institute of Company Directors and she is the chairman of the GPGC. The GPGC, which we are going to speak about today. Welcome, Nicole, and thank you for joining us on MedCentres TV podcast today. I know we've been talking for a couple of weeks, and finally, you are here, and we are stoked to have you on this podcast today. For those that don't know who Nicole was, like we said in the introduction, Nicole is the chair of the GPGC, and today we're going to talk a little bit about yourself, and we want to talk about the exciting opportunities that GPGC offers to our community of GPs here on the Gold Coast, which from our discussions before we got on air was really exciting and really refreshing. So tell us a little bit about yourself, Nicole.
My career started as a veterinarian, of all things.
A vet?
A vet, indeed.
Wow, okay.
And then I had a transition through to general practice when I realised that a lot of the stuff I enjoyed about vet was actually helping out my little clients, my little furry clients, helping out their owners. So it is a lot of looking after the owners, so much more than looking after the animals. So I transitioned and did my training through Griffith University and did my residence and internship up at Logan Hospital and then started my GP training at Browns Plains, in fact. And that was a fabulous practice run by a really wonderful GP called Melissa Carhill. She was fabulous. And I finished my GP training down here at Robina. And I was lucky enough to meet Dr. Lisa Beecham, who is now the chair of the Gold Coast PHN. And it was during my training with her, she tapped me on the shoulder and said, have you ever thought about sitting on a board? They're looking for a registrar to join them. And I balked at the idea and said, no way, I'm not doing that. That's crazy. And I had a chat to my husband who's in business and he said, no, give it a go. I think you'll be good. So I got onto that board and that was GPTQ, which is now been absorbed into the RACGP with the new training programs. And from there, I ended up transitioning to live in the Blue Mountains and sat on the PHN board down there, which I still sit there, which is Wentworth Healthcare. And so they look after, the PHN down there looks after the Blue Mountains region, Nepean and Hawkesbury. So I sit on that board. With our transition back to the Gold Coast, I'm now a GP at Morelambar and the chair at that time of GPGC, Tamara Warby, and Dr. Laura Baxter, who is our secretary, tapped me on the shoulder and said, we need someone to join our board. Would you be interested? And that overview of how I've got to where I am.
Like having spent a little bit of time with you, now it's amazing the wealth of knowledge that you have, not just as a clinician, but also commercial, on most aspects of everything. And I think that GPGC is very, very privileged to have you. I know that every time we have a chat, it's refreshing, it's energizing, it's informative. So, before we get back to yourself about why you've joined these boards, of what you've learned, and how's that experience molded you along the way with everything else, tell us a bit about GPGC, and what is GPGC?
So, GPGC is a member based organisation made up of general practitioners. And our main role is kind of threefold. So, we do a lot of advocacy work. So, we're trying to improve things for our general practice on the ground. We do some educational activities and we provide networking activities for our local general practitioners. And the goal being, as you and I spoke about, to try and improve that communication and that community feel of general practice on the ground, basically at the Gold Coast, but also crossing the border to northern New South Wales. So our poor GPs in northern New South Wales really struggle with some of the cross-border stuff. So at the moment, a lot of my advocacy work is trying to improve that tertiary flow between northern New South Wales and the Gold Coast University. Yeah. So that's where we're at.
You told me that GPGC is also on a lot of boards. Can you explain?
Not so much boards, but we sit on a lot of forums and councils. Yeah. So at the moment, we've got numerous places that we're involved in. So currently, the Primary Care Queensland, that's PCQ, which is again a network across Queensland, including the higher echelon, so right up to the university hospital levels. It lets us know what's happening in the space. This came from COVID, which is great. So we often get updates on what's going on with infectious diseases in the community and other important data sharing projects that are happening on a higher level that GPs might not be aware of. The other things we sit on are the Clinical Council of the PHN and GoldNet, which is a research group, which that primarily are looking at research in general practice. So they're the three big ones. We've got our finger in a few other little pies, but they're the three big ones that we are actually actively involved with.
So you'll have a voice and you're part of the decision making.
Absolutely. Yeah.
That's wonderful to know that, the organization, which is predominantly based off GPs here. What's your membership at the moment?
So at the moment, our active membership's around the 250 mark. It has definitely been higher in the past, and we would really love GPs to get more involved. So the idea would be to grow that significantly over the next 12 months and encourage people to join up, because we want to improve that networking opportunities for our general practice, as you and I spoke about. You really improve that over the next little while and help our local GPs.
It's exciting. I mean, to be part of a community and have a sense of belonging, and also being able to provide support, to exchange ideas with your peers, and also information, like you said, being part of these different forums, you're at the cutting edge of decision making and information. Like you said, the data. And obviously, data and information is key, right?
Absolutely. And it allows us, we've got the Facebook page, which some people might know about, and you'll often see bits and snippets of information being posted up on there that's come through from the Gold Coast University Hospital or from these higher level of health, to let people know what's actually happening on the ground. So things like recently there was a monkeypox ad that we put up to say there's a webinar coming up. There's been a few cases reported. This is information for GPs on the ground that you might know. Monkeypox. Yeah.
There you go. Monkeypox. I think it's often overlooked, the role of a GP, the responsibility that comes with being a GP, making critical decisions every day, and then going back home to your everyday life, be it your kids, be it your family, etc. And, an average GP might see 20 plus patients a day, 20 to 30 patients a day, and every patient requires attention and decisions to be made. And, it's becoming more prevalent, mental health. But what about the mental health and support for our GPs?
Yeah, I think this is a really crucial area and one that I'm hoping GPGC can help in, just to provide that little bit of networking community. And I think you and I spoke about some ideas. Hopefully at the end of the year we're going to have a little trivia night just where people can socialise, support one another. I'd really love to get that walking group happening where we can, have a catch up with a morning coffee before work if you're available, go for a walk along the beach, basically share what's happening in your world so that you've got some support. There are great supports out there that GPs are probably not aware of. So the RACGP provides a confidential support. There's Doctors for Doctors, Black Dog Institute. They have support specifically for healthcare workers. But I think a lot of us GPs, we're so isolated. We're stuck in our little rooms all day. I think we really, just having that peer-to-peer support would be a very good first step, whether it's to talk about a difficult patient you've had or just to say, hey, life's a bit tough right now. I think that would help a lot.
It would. Definitely. I'm being married to a GP myself. I put my hand up and say, yes, that definitely would help. The other thing with regards to GPGC is we were talking about membership and what that means for the organization, what that means for our GPs in our local community. Very often everyone has an opinion, but there isn't a platform for them to air their opinion. And so when we speak about GPGC, I got excited about all the different things that you all are planning, growing this community. And I think that's the thing. It's exciting. There's a sense of belonging. And obviously, you're an independent, standalone organization, so you're not affiliated to anyone. So you're not biased to anyone. And whatever you'll stand for, it's the voice of your entire community of GPs. So why not join?
Agree. And, the other role we want to do is just improve that communication. So improve that connectedness with GPs and improve that connectedness and respect between GPs and other specialists, in the tertiary sector or private. And also, we can't forget our other allied health professionals. So we need to work closely too with our physios and our dietitians and the whole gamut of people that provide excellent health for our patients. And so you really want to build the whole health community. And
That's
they do.
awesome.
Yeah, well, they talk about the One Health network, and that's what you want to aim for your patients, a smooth transition. But we can only get that by building those relationships.
Absolutely, and communication, so everyone's on the same page. And then I went into your Facebook page, and there's a part there where you can connect, like GPs, patients, but there's also some lighthearted stuff. GPs having a coffee the other week, and I think that's really good for your mental health. That it's not just about all things clinical or having a voice for everything else, but just that connection.
I agree. I think we need to work more on building that connection. So I expect to see you at our trivia night with your
I'll be there
lovely
for the walk.
wife.
I would. So you'll currently have how many members?
Around the 250. I think we could certainly be building that. And I think the other thing to know is that, on that website you're talking about, we can search other GPs with other special interests. So again, building those relationships with, whoever the doctor is down the road who might do a lot of skin work that you can pick up the phone and ask, or someone who might have a really big interest in menopause or whatever the situation might be that you are maybe not quite across, but know that you can pick up the phone and ask them or send your patient to them for that particular consultation or an iron infusion. It's also searchable by the general public. So if the general public need to find a GP with a special interest in a particular condition, they can do so. So we need people to put up their profiles, though. It doesn't work unless GP.
So if you've got a membership of 250, you're doing really well. That means there's another 150 GPs out there
I
that
think we could probably double it.
need to come over. Need to come over. And how fabulous would that be if you're having a get-together or a conference or whatever it may be, or a webinar, whatever it may be, of having all our local GPs
Yeah, it'd be great.
in our community, you know. I think we can make a change. We can make a difference. It's informative. Yeah, it would be great.
Yeah, I think it'd be really good. And we're hoping to just run a 30-minute forum, and there's one coming up at the end of August, just to get GPs online to just say, hey guys, what are the issues that you're facing at the moment? It's 30 minutes of your time. And we'll do that on a fairly regular basis just to see, and you don't have to come, you know, there might be a month that you can't come. You know, whoever is available in the practice can jump on and say, right, these are the issues we're facing, or could GPGC be involved in these particular aspects of our working life, and we need X, Y, and Z, because that keeps me more informed, keeps our board more informed, and we can move the company to do what we need our local GPs to do, because it's a member-based company. So,
And you can't do everything yourself, of course.
that's right. So I can get people involved, and we spoke about getting our GPs involved to sit on some of these forums that I attend, you know, to be more connected to what is actually happening on the ground, because together we can have a larger voice, and we have the mechanisms. They're there.
There's a lot of smart people out there, you know.
There's a lot of very
There's a
smart
lot of
people.
untapped smart people there with a voice,
Yep,
and we just need to tap into them.
that's right.
Having your fingers in a few pies, so to speak, or forums. The benefits of that, you know, the information and how fast you'll get that information. For example, you were saying something to me off air earlier about an organization. Was it to do with mental health, or was it to do with, can't recall?
Yeah, so we've got, because of all the different forums we sit on, you're right, we've got a lot of fingers in a lot of pies. And I think the advantage for us as general practitioners means that networking opportunity for whoever's sitting on that forum can raise a particular issue, and it can get up the chain pretty quickly. And I think that's where the advantage for us lies. In regards to mental health, you know, most of those are run by either the PHN filling gaps for our community mental health, or those other organisations we spoke about before. But I do think it means that because we've got 4 or 5 forums or councils that we sit on, that's a lot of influence.
I was just thinking, look, imagine we have all 400 GPs on our forum, on GPGC forum, and you're a part of other forums where they are making decisions. They're going to have to step back and listen. Absolutely. And so often you hear, whenever there's new policy, either by Medicare or any other governmental organization, I hear this all the time, you know, from people on the ground, is how are they making these decisions if they don't actually know or understand what happens on the ground? Yeah. So, you know, it would be refreshing if our GPs got involved in those decision-making processes, because then, you know, you'd get the outcomes, those positive outcomes, and the ones that GPs want.
Yeah, absolutely. And the policymakers can't make those decisions and not understand what's actually happening on the ground. And we're not ever going to be perfect. You know, advocacy is not about getting all your wants, because there's always other moving parts, but it's about having a voice and actually changing the things that we can change. And there's a lot that we can change, and there's a lot that we can make better. But it has to start with small steps, and it has to start with people being engaged, as you said.
Building that community of belonging.
Building that community. We need a community.
And you know, there's a new podcast that's coming out from GPGC. I'm very excited to be part of that. And we're going to have some exciting people on, some very informative, some lighthearted discussions as well. And there's a lot of new events that are being planned with you and your team. And so looking forward to those as well. It's refreshing, Nicole, to hear some of your vision for GPGC, but I understand that you can't do it all on your own. So at this point in time, What is your vision? What's your goal or your vision for GPG? What would you like to see in an ideal world?
In an ideal world, I'd like to see a much more connected general practice community. That's what I would like to see. And in addition to that, I'd like to see general practice being as respected as all our other specialists, because I feel like there's a big disconnect between what we do on the ground and what the other specialists do, whether it's the cardiologists or the endocrinologist. And what they don't understand is that we actually are an incredible, capable, wonderful workforce that really do hold the fort. And we can actually take the pressure off a lot of our tertiary setting if they give us the right tools and they give us the right support.
And
to
give
do
us
so.
an ear as well.
Give us an ear. So in my ideal world, it would be a seamless healthcare system whereby you'd have your general practitioners working closely with all the other specialists and all the other allied health easily, without any disrespect, without any of this political argy-bargy, and there would be respect across all doctors and there wouldn't be this hierarchy.
How can we bridge the gap, Nicole? And why is there such a, like you say, a hierarchy, a gap? What is it? It's been there for a long time.
It's historical, I think, isn't it?
Yeah, it is. But why?
Oh, why? I don't know how it started. I think it's definitely a historical throwback. I think now us not being part of that tertiary sector, I think there's a lack of understanding of what we do. And I think that's a large part of it, which is why hopefully, the podcast you and I are looking at, bringing specialists in, will hopefully break down some of those barriers where there is a really good understanding of what all of our roles are. And all of us are vital for our patients. It's not just one person. We all need to look after our patients and have our role.
What about the hospital system and the processes between GPs and the hospital and communication? It's always been kind of the bane.
It's an ongoing battle, isn't it?
Yeah. But I think, with this family and community, that communication, like you said, we bridge the gap. And, there's better communication with the decision makers because people on the ground are giving
the right
feedback.
information.
Yeah.
Yeah. Look, it's difficult between us and the tertiary centres, and there's always been a disconnect. We don't get the discharge summaries, or someone presents to ED and we have no idea that that's even happened. It's tricky. They get discharged with plans in place that we are often unaware of. So
Very often, yes.
It's very hard. I do know that they are working on it. There are people, I think the important thing to know is there are people out there who are actually actively trying to address this. And again, it comes down to that communication piece. If we are unaware of how often these things are happening, we can't advocate. Like we need that information to be fed up to an organisation like GPGC or other different organisations so that we have an understanding of how bad is it and what can we do to address those gaps. Getting better. I think it is getting better. There are the GP liaison officer at the Gold Coast that unit is definitely trying to help with this.
Well, that's great. I'm going to talk about something that's really basic but very pertinent. There's so many practices, general practices on the Gold Coast, right? Yet when you walk into every one of these practices, they're different. Their systems, their staff, they're all different. And I just feel that, like, forming GPGC and having a bigger community, that information, the know-how, the education will filter into the management, to staff, empowering, practice managers, empowering receptionists, nurses, and with information and know-how and systems and protocols, so that it's unified. It's one kind of system, one health system. We always talk about the one health system, but it starts with the people on the ground.
It starts with those relationships. And I think it is important, you might run a practice a certain way and have had benefits in a certain way. And why is that information not being passed on? Why is it not being shared? And so I think if you build those relationships, you can share it. Like I've used a particular IT system, or I've used a particular way of running something that has saved money or saved time, or has actually improved patient outcomes. That's really important information that should be shared across practices.
But it's not.
It's not. It's currently
A
not.
typical example of where probably being disjointed in the industry was when COVID happened. Things changed by the hour. Decisions were being made by the hour.
Yeah.
But all the different practices reacted differently to the changes. And there was a lot of people in the dark as to what do we do now. What happens if someone with COVID enters a practice? What's happening in terms of do we now, whatever the changes were. So that's a typical example of lack of communication, where if we had people on the ground with one system, it would have been so much easier to get change made, especially in a situation like COVID. Who knows what happens in the future? We could have another virus. So, we could have another plague. We could have, So it's really important. And I think GPGC has a big part to play. A voice, in that decision making.
Absolutely. There could definitely be a voice, and we just need that engagement so that we know how people are managing particular situations, and we can get the advice if we need to seek it from higher up the chain. We can get more pertinent advice, and we can feed it all back to the local general practices. So, I think there's definitely room for a huge voice.
So what's next for GPGC?
What's next? I think
what's up and coming?
Up and coming, we've got that event that I told you need to come to. So the trivia event, which will happen hopefully towards November, is what we're planning on. We're trying to get a neurodiversity event, as you know, that there's an educational event up and running. That'll probably be early next year, I think, at this time. But watch this space. And we've had one of the specialists reach out to us and say he's interested in helping us get an event up and running.
Fantastic.
So there's 3 events planned in the next little while. So keep an eye on the Facebook page, because that's where we put them all up.
And watch out for GPGC podcast coming soon.
Watch out for GPGC podcast.
Great.
Yeah.
Nicole, it was fantastic, enlightening, and a breath of fresh air having you on MedCentres TV. We look forward to having you regularly, and we look forward to partnering with GPGC for the future. There's so much exciting happening, and thank you for your vision, for your energy thing that you are doing. And I think GPGC is really, really fortunate to have someone like yourself. So thank you. That's another episode of MedCentres TV. I hope that you found it enlightening. I hope that all those GPs out there that have not yet signed up to GPGC, do yourself a favor. Get involved, join the community, and belong to something, because only you can make a difference. Bye for now.